CCHT Test Hemodialysis Technician Practice Exam and Study Guide 25 Most Common Questions. Question 1. The primary goal of hemodialysis is to cure kidney disease, remove waste products and excess fluid from the blood, increase the patient's heart rate, make the patient sleep. Dialysis replaces the filtration function of failing kidneys. Question 2. Which of the following is a common complication during a dialysis treatment? Hypotension, low blood pressure, high fever, increased appetite, instant weight gain. Fluid removal can lead to drops in blood pressure. Question 3. The dialyzer is also known as the heart of the machine, artificial kidney, blood pump, water filter. The dialyzer is where the actual exchange and cleaning happens. Question 4. A fistula is created by surgically connecting an artery to a vein to a vein, an artery to an artery, a nerve to a vein. An arteriovenous AV fistula is the gold standard for dialysis access. Question 5. The presence of a thrill and bruit in a fistula indicates the access is clotted, the access is functioning and has good blood flow, the patient has an infection, the patient is having a heart attack. Technicians must feel the thrill, vibration, and hear the bruit, whoosh, before every treatment. Question 6. What is the standard blood flow rate BFR during a typical dialysis treatment? 50 to 100 ml/min, 200 to 400 ml/min, 1000 to 2000 ml/min, 10 to 20 ml/min. Typical BFRs range from 200 to 450 ml/min. Question 7. Dialysate is a solution made of pure water and chemicals, electrolytes, milk and sugar, blood from another person, normal saline only. Dialysate is customized to the patient's needs to draw out toxins. Question 8. Which electrolyte is most commonly monitored and restricted in dialysis patients? Sodium, potassium, calcium, magnesium. High potassium, hyperkalemia, can lead to dangerous heart arrhythmias. Question 9. The process of removing excess fluid from the blood during dialysis is called diffusion, ultrafiltration, osmosis, convection. Ultrafiltration uses pressure to push fluid across the membrane. Question 10. Dry weight is the patient's weight when they are wearing dry clothes, they are at their target weight with no excess fluid, they have just eaten a meal, they have just finished a workout. Achieving dry weight is a goal of every dialysis session. Question 11. Which of the following is a sign of infection at an access site? Redness, warmth, and swelling, the site being cold, a strong thrill, a soft bruit. Access infections are serious and can lead to sepsis. Question 12. The first-use syndrome is a reaction to the dialysis machine's noise, the new dialyzer or sterilizing agents, the technician's gloves, the chair in the unit. Patients may react to chemicals used in the manufacturing of new dialyzers. Question 13. Patients on dialysis are at high risk for which bone disease? Osteoporosis, renal osteodystrophy, bone cancer, scurvy. Kidney failure disrupts calcium and phosphorus balance, affecting bones. Question 14. What is the purpose of heparin during dialysis? To lower blood pressure, to prevent the blood from clotting in the circuit, to treat pain, to increase energy. Heparin is an anticoagulant used to keep the blood flowing freely through the machine. Question 15. Which organization sets the standards for water quality in dialysis? FDA, AAMI, CDC, AMA. The Association for the Advancement of Medical Instrumentation, AAMI, sets water standards. Question 16. Steal syndrome is a complication where the machine steals the patient's blood. Blood flow is diverted away from the hand, causing coldness and pain. The patient steals equipment. The dialysate is too strong. Steal syndrome occurs when the access takes too much blood away from the distal limb. Question 17. Air in the dialysis circuit can lead to a fatal heart attack, air embolism, infection, muscle cramp. Air entering the patient's bloodstream can block blood flow to vital organs. Question 18. The transmembrane pressure (TMP) is the difference in pressure between the blood and dialysate sides of the membrane, the patient and the machine, the room and the unit, the artery and the vein. TMP controls the rate of ultrafiltration. Question 19. How often should a dialysis technician wash their hands? Only once a day, between every patient contact and after removing gloves. Only if they look dirty. Never, because they wear gloves. Hand hygiene is the most important way to prevent the spread of infection. Question 20. K/V is a formula used to measure the patient's height, the adequacy, effectiveness of the dialysis treatment, the speed of the pump, the weight of the dialyzer. KT/V measures how much urea was removed during treatment.